There are multiple factors that contribute to why people of color bear a greater burden of asthma severity and frequency of exacerbations. Of these, the most significant determinants are structural and social in nature. So when you look into uh, kind of the history of redlining and how certain communities of color have been essentially corralled into areas, urban areas that are adjacent to highways where they have greater exposure to airborne pollution and particulate matter, that's a determinant. The social determinants of decreased income, so income disparity, which then plays into the ability to afford medications, to have access to reliable and high quality healthcare. These play into healthcare disparities with asthma, and also a history of mistrust of the medical profession. For Black communities and Indigenous communities in particular, there's been a well-documented history of inequity and overt discrimination and abuse in healthcare in the past. And this has led to a deep-seated mistrust of medical professionals and medical recommendations in certain communities. And so we have a lot to overcome. You know, people ask if genetic factors or individual behaviors can be the determinant of why we're seeing these differences in asthma severity in communities of color. But the data doesn't really bear that out. The structural and social determinants of health are way more impactful than individual determinants. And so that means we have an opportunity with legislative agendas and healthcare agendas to really make a big difference in asthma disparities if we make the right choices.